Sure. Here's the continuation of the story or topic in English: segregation of child molesters in prisons. In many correctional systems, individuals convicted of child molestation are often placed in segregated units, separate from the general population for safety reasons. This is primarily done to protect them from other prisoners who may view their crimes as particularly heinous and may seek retaliation or justice. In some prisons, such offenders are housed in specialized sex offender units or protective custody units. However, these units can vary greatly in their conditions. While the goal is to protect these inmates from harm, the reality is often much harsher, with some inmates enduring extreme isolation, mistreatment, and even violence. The conditions in these units can sometimes be so severe that they have been described as inhumane. Specialized units and their impact. Protective custody and isolation. Inmates convicted of sex crimes, particularly child molesters, are often placed in protective custody to shield them from the potential violence of other inmates. These units, however, come with their own set of challenges. Some offenders may spend long periods in isolation, sometimes for months or even years, with very limited human interaction. While protective custody keeps them safe from physical harm, the psychological toll of such isolation can be profound. Solitary confinement can lead to depression, anxiety, and other severe mental health issues. Sex offender treatment units. Some prisons have specially designated units for sex offenders, including child molesters. These units are intended to focus on rehabilitation, offering therapy and counseling to help offenders address the root causes of their crimes. However, these units can also be sites of significant tension and violence, as the stigma of being a child molester often makes it hard for these individuals to integrate or receive adequate care. Criticism and legal challenges. There are significant concerns regarding the treatment of inmates, especially child molesters, in these segregated units. Inhumane treatment. The conditions in some of these units have been criticized as inhumane. Inmates in isolation may be deprived of meaningful human contact and subjected to cruel or degrading conditions. Critics argue that this violates international human rights standards, including the prohibition of cruel and unusual punishment. Physical and psychological abuse. Inmates convicted of child molestation are often subjected to physical abuse or harassment, either from other prisoners or from correctional officers. While it's understood that they may be targeted for their crimes, some see this as an abuse of power that further perpetuates cycles of violence within the prison system. Eighth Amendment and human rights. In the United States, the Eighth Amendment of the Constitution prohibits cruel and unusual punishment. Legal challenges have been brought against the conditions in some segregated prison units, arguing that subjecting individuals to extreme isolation or abuse is unconstitutional. International human rights organizations, like the United Nations, have also criticized practices that lead to severe mental health deterioration among isolated prisoners. The debate: justice versus rehabilitation. The treatment of child molesters in prison also raises deeper questions about justice and rehabilitation. On one hand, many people believe that those convicted of such heinous crimes should face severe punishment. On the other hand, others argue that prison should not solely be about punishment. It should also be about rehabilitation and reintegration into society, especially for those who are seeking to change. Punitive measures versus reform. There is a strong societal push for retribution for those convicted of serious crimes like child molestation. However, focusing purely on punishment often ignores the potential for rehabilitation, especially if individuals are subjected to extreme isolation or abuse that may reinforce criminal behavior rather than address the underlying issues. Rehabilitation programs. Some experts believe that addressing the psychological and emotional needs of sex offenders through therapy and rehabilitation programs is essential for reducing recidivism. Programs focusing on cognitive behavioral therapy, sexual offender treatment, and victim empathy have been shown to reduce the likelihood of reoffending in certain cases. However, there is also a significant challenge in providing such programs consistently, especially when the public demand for harsh punishment remains strong. Public sentiment and legal responses. Public opinion plays a significant role in shaping the treatment of child molesters in prison. People tend to view these individuals as especially dangerous, and as such, many support the idea of treating them harshly, both in terms of prison conditions and the length of their sentences. The desire for retribution often outweighs calls for rehabilitation or human rights concerns. However, the legal system faces pressure to balance these public views with constitutional protections for inmates. Efforts at prison reform, such as reducing the use of solitary confinement or improving rehabilitation programs, often clash with public sentiment, creating an ongoing debate about the best way to handle offenders convicted of heinous crimes. Conclusion. The treatment of child molesters in segregated prison units is a deeply contentious issue that touches on complex ethical, legal, and societal questions. While segregation may be necessary for safety reasons, the conditions that result, such as isolation, abuse, and psychological harm, can raise serious human rights concerns. As society grapples with how to balance punishment, justice, and rehabilitation, the debate continues over the most ethical and effective ways to handle those convicted of such terrible crimes and whether their treatment in prison should prioritize retribution or rehabilitation. It seems like you're asking for more information or the next part of the topic. Let's continue with a deeper look into some key aspects related to the treatment of child molesters in segregated prison units. The long-term impact on inmates in segregated units. The long-term effects on inmates who are placed in segregated units, particularly those convicted of child molestation, can be profound. The combination of isolation, stigma, and the overall prison environment can lead to several psychological, emotional, and behavioral consequences. Mental health issues. Extended periods in isolation or protective custody can lead to severe mental health issues. These include depression, a common outcome of long-term isolation, where the lack of social interaction and a limited environment contribute to feelings of worthlessness, sadness, and despair. Anxiety and paranoia. Fear of physical harm, whether from other inmates or even guards, can cause high levels of anxiety and paranoia. Psychosis. In extreme cases, isolation can lead to hallucinations, delusions, and severe cognitive disorientation, often due to the lack of stimuli in solitary confinement, stigmatization, and social isolation. In the prison setting, individuals convicted of child molestation often face extreme stigma from both fellow inmates and correctional officers. This social isolation can make it difficult for these offenders to ever reintegrate into society after release. Their status as pariahs often leads to loneliness, emotional distress, and a deepening sense of alienation, all of which hinder their ability to form healthy relationships and re-enter society. Post-prison challenges. When these individuals are eventually released, they often face extreme difficulty reintegrating into society. The combination of their criminal history and the lasting psychological effects of incarceration can make it hard for them to find stable housing, employment, and community support. This social exclusion contributes to a cycle of recidivism, reoffending, as many of these individuals may resort to criminal behavior out of desperation or because they feel they have nowhere else to turn. Rehabilitation programs. The potential for change. While public opinion often calls for harsh punishment for child molesters, many experts in criminal justice and psychology argue that rehabilitation should play a significant role in their treatment. In some cases, offenders who undergo appropriate rehabilitation programs have shown a decrease in the likelihood of reoffending. Rehabilitation programs can focus on various aspects of the offender's behavior, mental health, and understanding of their crimes. Cognitive behavioral therapy, CBT. CBT is widely used in rehabilitation programs for sexual offenders. It focuses on helping individuals recognize and change harmful thought patterns and replace them with healthier ways of thinking and behaving. For example, a child molester may be taught to recognize distorted beliefs about children or sexual relationships and work to change those thoughts. Sex offender treatment programs. These programs are designed specifically for individuals convicted of sexual crimes. They often include therapy, group counseling, and educational components to help offenders address the root causes of their behavior. These programs aim to help offenders build empathy for their victims, understand the long-term effects of their crimes, and develop strategies to prevent reoffending. Restorative justice approaches. Restorative justice is an approach that seeks to repair harm done to victims and offenders by facilitating a dialogue between the two parties, when appropriate. While it may not always be applicable for individuals convicted of child molestation, in some cases, restorative justice programs help offenders understand the full scope of the damage they've caused and take responsibility for their actions. These programs can incur a